The patient is positioned prone in the appropriate position for a posterior approach and is prepared and draped in a conventional manner. Utilizing anterior, posterior, and lateral fluoroscopic imaging, the targeted pedicles are located and marked on the patient's skin. A percutaneous skin incision and fascia release of approximately 1.5 centimeters is made at the location marks on the patient's skin. A biopsy needle is advanced through the skin incision and the needle tip is docked onto the targeted pedicle and verified with fluoroscopic imaging. Once proper trajectory and docking of the biopsy needle is confirmed, the trocar is removed and replaced by a guide wire. With the guide wire in place within the confines of the vertebral body, remove the cannula while ensuring that the guide wire maintains purchase within the pedicle. Dilation of the opening through the muscles is performed in a two-staged sequential manner over the guide wire. Remove the first stage dilator from the incision site. With the second stage dilator in place over the guide wire and acting as a soft tissue protector, the appropriate cannulated tap is selected, advanced over the guide wire, and the pedicle is prepared for a cannulated bone screw. Verify depth and position with fluoroscopic imaging. The taps of the ballista system are calibrated and etched accordingly to provide the surgeon with the appropriate length screw necessary for the procedure. Upon completion of pedicle preparation, the tap and second stage dilator are removed from the patient, leaving only the guide wire in place. Load the indicated cannulated screw onto the distal end of the screw tower. Load the cannulated screw inserter shaft into the proximal end of the screw tower. Mate the distal end of the screw inserter shaft to the proximal head of the screw and turn the knurled portion of the screw inserter clockwise, threading the screw inserter into the head of the cannulated screw. Advance the screw tower assembly over the guide wire and insert the screw through the pedicle and into the vertebral body while verifying depth and trajectory with fluoroscopic imaging. Upon confirmation that the screw is in the proper place, remove the guide wire and screw inserter shaft, leaving the screw tower in place. Repeat steps 1 and 2 for the second pedicle. With the screw towers and respective cannulated bone screws in place, attach the screw tower compressor distractor instrument to the towers by guiding the cups of the CD instrument into the proximal end of the screw towers. The CD instrument fulfills 4 functions for the procedure. It allows the surgeon to compress or distract the disc space, aligns the screw towers in parallel, lining up the tulip portion of the screws to permit rod placement. It stabilizes the screw towers while other surgical procedures are performed, and it allows for determination of rod length. With the CD instrument in place, tissue elevators are advanced from screw head to screw head through the screw towers to initiate a path through the soft tissue, aiding in subsequent rod placement. Load the appropriate length rod onto the rod inserter by taking the rod and sliding the mouth of the rod onto the pushing mechanism of the rod inserter. Then pull the trigger of the rod inserter to open the jaws at the distal end of the inserter. With the jaws of the rod inserter open, line up the pivot hole on the rod and release the trigger to secure the rod in place. The ballista rod inserter also comes equipped with a safety button to lock the mechanism, preventing premature release of the rod. This safety lock should be engaged prior to implanting the rod. To implant the percutaneous rod, advance the loaded rod inserter through the cephalid or caudal screw tower. Using fluoroscopic imaging, slowly pull on the handle of the rod inserter to articulate the angle of the percutaneous rod until the rod is seated within both screw heads. Upon full seating of the ballista rod, insert the counter-torque instruments through both the cephalid and caudal screw towers. Load the helical flange locking plug onto the plug starter and introduce the plug through the counter-torques and provisionally tighten. Utilize fluoroscopic imaging to ensure that the ballista rod and helical flange plugs are properly seated and aligned. The rod inserter is released and removed from the ballista rod. At the surgeon's discretion, final compression and distraction is applied to the construct, and the set screws are tightened using the torque wrench until an audible click is heard. After the final torque of the plugs, the construct can be disassembled. The CD instrument is released from each screw tower and removed. The screw towers are released from the screw heads and removed from the patient. Perform closure of the percutaneous operative sites in layers according to standard protocols and facility guidelines.